Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. And I have a special guest, one of my favorite interviews because he's so insightful and he's gone through some interesting transitions. That's Marc Probst, CIO of ELLKAY. He's also the John E. Gall Jr. CIO of the Year, which I'm sure he loves when we talk about this. But welcome, Marc. Glad to have you here.
John, thank you. It's really nice to talk to you today.
Yeah, so I mean, I think most people in my community know you, having been on so many communities, former CIO at Intermountain, and you recently decided to retire from Intermountain. And you know, in an interesting choice, your choice of retirement is to now become the CIO at ELLKAY. So you know, I think it's going to be great to hear what went into that thinking and that decision making for your career. But before we get there, you know, as retiring from Intermountain, what do you think your greatest lessons learned were from the job, you know, being CIO there?
Wow. You know, there's an interesting story underlying that, John. And I spent 23 years in consulting. I was a partner at Deloitte and a partner with Ernst & Young, and all of that in healthcare IT. And it's just interesting because someone I had worked with became the vice president of human resources at Intermountain Healthcare over 17 years ago. And she had asked me if I would apply for the job, and I said, you know, I don't think so. I mean, I'm doing this consulting thing. And she said, there was a longer story to it, but the end of the story was, as she said, her name was Phyllis. Phyllis said, Marc, you need to prove to people that you knew what you were talking about for all 23 years you've been doing this. And so kind of laid the gauntlet, and that was enough that I did apply and I got it. And I can tell you right now, I hadn't a clue. I hadn't a clue how to be a good CIO. So when you ask me what I've learned, so much. And I would think if I really need to boil it down to a major emphasis on what I learned, it was just how much we have to be able to work with others and depend on others, because it's such a complex area, IT and healthcare. And it's a complex industry to start with, and IT is very complex on top of that. And if we can't depend on others, if we can't partner well with others, we ultimately aren't going to succeed. But if we do, on the other hand, do a good job of selecting good partners, selecting good employees, trusting them and working with them, I think you know, there's the potential to be very, very successful. So you know, my success came from others. I was just honored to be able to be in the role to kind of orchestrate that.
Yeah, that's a great lesson, and I think great feedback. But yeah, we can't do this alone in healthcare. That's a great lesson. So, you know, I think it's interesting for many of us that look at it, you know, you've had a nice career as CIO and consulting, and you retired, and as a retirement, you chose to go to ELLKAY as their CIO. You know, it kind of reminds me of the 90-year-old pharmacist I worked with, and I said, why are you still working? And he said, John, if I stop, I die. Is that the sentiment, or was it just an opportunity, or, you know, really, why did you decide to go and work for ELLKAY?
Yeah, so the retirement, I told Intermountain Healthcare last September that I was going to retire, and it had a lot to do with the industry itself, where the industry was headed, and kind of that I hadn't done everything I possibly could do at Intermountain Healthcare, and I don't mean that in an arrogant way at all, but that it wasn't, I didn't feel like I was the best fit for where a CIO needed to be for Intermountain Healthcare moving into the future. And that had more to do with my background, the time I'd spent, even the energy level that I had. I mean, I turned 62. So I told him last September that, you know, I was going to go. Now, I feel incredibly guilty, actually, having left in the midst of COVID. But, you know, I didn't know it was coming. And anyway, I think there's so many unique challenges that maybe we'll talk about today that I just felt kind of bad. But I'm incredibly excited for this opportunity working with ELLKAY. They're an organization I dealt with when I mentioned that, you know, it was important to partner with people. These are one of my partners, and you know, it's kind of a niche, not nichey, but it is a bit of a niche. You know, data plumbers, integration, those kind of aspects of IT. But it wasn't so much that; it was more the kind of people that lead ELLKAY, and just how much I trusted them, how much I admired them for what they'd built to this point, and I think the potential that exists to grow that business. And when I look at being the CIO of ELLKAY, I don't think it's managing 1,100 FTEs, which they don't have, but I did at Intermountain Healthcare, or managing this massive budget. It's really understanding the technology that we need, and then looking at how strategically we can apply that and really enhance the services that ELLKAY is providing and grow them and grow that business. And I'm really excited about the opportunity to do that. It's different, but it's different in an exciting way, and it's kind of got my juices rejuvenated to really get into it. Where I've been a CIO for 17 years, loved it, but this is a neat new opportunity.
Yeah, it's amazing what fresh eyes can do to your own position, but also your past organization as well. I think that's a valuable perspective. One area that ELLKAY works in, and you've been involved in deeply, is really talking about connectivity in healthcare. We've been talking about it for a long time, but what do you see as really holding us back, and where should CIOs be focused when it comes to connectivity in healthcare?
Yeah, so what's holding us back is momentum, I suppose. I don't want to call it data blocking. I don't want to call it that there's anyone out there really with malintent. But the momentum has been with these legacy systems that we've had and all the things that we've historically done, and that's created a very complex environment with non-standard data, and a lack of standards in the industry overall. And I can't have a conversation like this without using the S word, standards. And so that momentum is making it harder for true interoperability and true integration to happen. But again, I do think the players all get it, and they want to do the right thing around it. But it's hard and it's expensive, and we don't have a national strategy to do that. And if we did have a national strategy to do that, I think over 10 years, we probably could get to exactly where we need to be. We lost an opportunity with meaningful use to really focus on that, right, and spend some of that money on that. But it was a different program, right? It really wasn't about setting up standards. It was about spending money on health IT, doing the best that we could, but it was really a stimulus package. So I don't know, so it's that momentum that's really making it difficult. So many good people engaged in. Don Rucker is an amazing person. I really imagine doing what he's trying to do in this environment would be really, really difficult. And the other national coordinators were, I really respect those individuals. So as a CIO today, looking at what we can do, there are some standards we should be moving toward, and we are. FHIR is a decent standard. It's getting us going in the right direction. There's a lot of other standards out there. Dealing with people that have APIs that can bring that data together in a more fluid way, like ELLKAY, there you go, there's my plug for my company. But it is important, right? And it is helpful, and it can help move things forward rather than all that. One of my early on kind of constant thorns in my side with healthcare IT was we all felt like we had to reinvent the wheel, just slightly different, but we all felt like we did. And again, it was the environment. There was no bad intent there, but we did. And some ways around interoperability, we're doing the same thing. We're all feeling like we got to build our own integration. We've all got to buy different integration engines, and sometimes our vendors are pushing us to that, sometimes they're not. But I think we can get to, as we get to more standard partners, we're going to be able to do a better job of it moving forward. And so those are some of my thoughts.
I think that's a great perspective. The thorn in my side is that we try to boil the ocean when it comes to interoperability. Yeah, do you see that as well? And do you see? I like the idea of skinny interoperability, right? Like something that's needed, something that everyone can get behind, and maybe that creates the momentum that you're talking about. How do you look at it from a, do we need to solve everything, or can we do smaller scale interoperability?
So the answer to your question is we do need to solve everything, but I like your approach. Right.
Yeah.
Incremental approach to get there at least gets us value along the way and solves some very important problems. How important is lab data? Really important. So can we get to good, interoperability between lab data? Well, I think we can, and that solves one problem. We've done it in pharmaceuticals by and large.
Yep.
And again, it's kind of there was an integrator there, became pretty much a monopoly, but worked, right? It got that standard out there, and we're able to do things around drugs. I think, we're going to do it around labs. We're going to do it around radiology. We're going to, maybe someday we'll get a patient identifier. We'll see. Seems like a pretty simple one, but politics also get.
It passed the House, so maybe one day. But yeah, I mean, even then, there's still identity issues. Do you think that COVID-19, which, we can't have an interview these days without mentioning COVID, but, is COVID maybe that momentum that's needed? Because I think it has expedited a lot of innovation, and maybe what other areas are you seeing COVID, expanding innovation in healthcare?
Yeah, I think it's created, it has put some fire behind specific kind of innovation, but the innovation's been a little haphazard, and it's just the way COVID happened. It happened so fast. We all had to do some unnatural things to meet the requirements of our organizations. We sent the whole workforce home. We sent the physicians home. We told patients they can't come into our hospitals or unless they were a certain problem, and they couldn't go into our clinics. And so we now had to facilitate the work that we do, which wasn't so much about making money. I mean, we need to do that to fulfill our mission, but it was, how do we take care of people in an environment where we really can't be near them? But we did it in a very fragmented way. We brought, like I said, this is like my 4th video technology I've used today. And and we did that across our organizations. I know at Intermountain, they have at least 5 different solutions for video connectivity. And thankfully the government gave us some relief so that we could do that and use it, and it wasn't perfectly secure, but it was okay. But anyway, so it was this very fragmented environment, and we're innovating around process, and we're innovating around how do you engage patients in this kind of manner. We're going to have to get around to innovating around what's the right sets of technology that we use to accomplish this, so that we can secure it, so that we can build it into workflow, so that we can integrate data into it, so that it's a more natural interaction like you would be in your physician's office. And right now it's just a little clunky. But man, if there's a silver lining to COVID, it is the fire that it put behind a lot of this digital connectivity with our constituents. And that's going to lower costs. That's going to make access tremendously better for our patients. And we're going to, a year from now, when I don't know, whenever COVID ends, but just after that, I think we're going to find some really neat innovation on how we can use these new tools in the most effective, secure, and best way. So it's really very exciting.
And to that point, what should a CIO be doing to make the most of a challenging situation? A friend of mine said, when there's waves, if you have the right surfboard, you can have a great time, right? Like, and I think it's like we're suffering through a lot of waves. So what are the surfboards that CIOs need to be navigating to make the most of a really challenging situation?
And they're doing it already. So then, preaching to the choir, I know I am. But they need to be very tightly involved with the operational and clinical leaders of the organization and people in the organization, because we won't figure this out alone. This isn't something you run back into the data center or the IT shop and come out, ooh, look at this brand new solution you now have. This is, how are we going to work together to get to where we need to be? So I think a lot of focus on that. I think, and I felt this way for 4 or 5 years. So, and I've been pretty open in CHIME meetings and those kind of things. The role of CIO, and it's actually one of the reasons why I decided to retire, is the role of the CIO is going to, in healthcare, is going to increasingly get more technical. If we don't understand technology, right, we either got to get the right partners to help us understand that technology, or we got to figure it out ourselves, because the role will become more technical. The operations will become more strategic, more directional on the kind of things that we do. So I would suggest to CIOs, 1, don't jump off any bridges, because this will pass. 2, really look at your technical capabilities and shore them up if you don't have them. And I don't mean just hire a bunch of good people. I mean, surround yourself with partners and other people that can help you really understand this landscape, because it's just going to be key moving forward. And then highly, highly align with the business itself, because that's where we will get the direction and we will find the success.
And it sounds like you're making the case that they need to be multidimensional. They can't just be technical and they can't just be operational. They need to almost merge those two. Is that what they need to be ready for what's coming next? Is merging kind of this multidimensional business operations and technical all in one?
Yeah, I mean, yes. But again, I think historically in healthcare, and maybe I'm just being critical of myself, we haven't been as technical, right? I mean, you even seen a lot of physicians that really didn't go through IT training. They just really liked IT or got good at it. They became the CIO or a nurse or whatever. And we didn't value that strong technical root that I think is going to be needed. So I think it's more than being multidimensional. If we want one skill that every CIO to be successful will be, it's their ability to have relationships and manage those relationships. And thankfully, I think that was a skill that I was able to build upon, maybe as my consulting years. But to me, I was never the brightest bulb on the tree. But boy, I had a lot of good people that would come to the tree and make it shine.
Yeah, it's it goes back to your initial suggestion that you need to make sure you have a good team, and you need to rely on good partners and a good team to make it successful. And that we can't win one of us alone. It takes a team to be successful. Looking back, what really has been the key to having a successful career? And it might even be worth asking, what do you think were the most successful parts of your career? If you're giving people advice, you've had a lot of experience. What would be your advice someone who's looking to become a CIO or has just become a CIO?
Humility really comes. Whenever anyone asks me what I think the #1 trait of a leader is, it's humility and being that servant leader. But beyond that, really being not falsely humble, right? Not fake, but truly understanding just how little any single individual can know in what we do. And that trait trumps any other trait that I think anyone can have, because everything else can be bought and surrounded and partnered or whatever. And I think I was lucky enough to be able to be in an organization that actually fostered that kind of humility. And Intermountain's changed. It's become a lot bigger, but it's still, by and large, a servant organization that's very humble. And it was able to really extract from individual leaders that trait. And I believe that's one of the main reasons it's been as successful as it has. And I'm just a cog in that very successful wheel. Certainly received more notoriety than I deserve for what's happened there. Because the things that preceded me were amazing, and the things that are going to happen now that I'm gone are going to be equally as amazing or better. What would I say? Man, what are the most successful things? And I just think it's an aggregate. How lucky or blessed, or whatever word you want to use, that when Obama comes out with a stimulus package that's dealing with meaningful use and all those things, that I had the opportunity to do that for 7 years, to interact with some of the most amazing people in healthcare and learn at the feet of the masters. How lucky was I to do that? How lucky was I to be involved with the people like Homer Warner that developed the HELP system, and really kind of all the people that worked with him, the medical informatics people, who taught me how important standards were, taught me how important the integration of process and workflow and those things were with the technology to solve the problems that we have in healthcare. So I believe luck has a lot to do with why some people have the opportunities that I have, and I just feel incredibly blessed to have had those opportunities. And yeah.
That's awesome. Well, I think you may be exhibiting some of the humility in some of your comments there, which, because I think you deserve a lot of credit for the work you've done. I can say personally for me, ironically, we first met when you were doing a meaningful use roadshow. I think they were doing a roadshow around the country, and you came to Vegas, and we were talking certification, and you were on one of the committees, and you were generous with your time and your kindness. So I've always appreciated you sharing your insights and perspectives, and I look forward to you continuing to be part of the community at ELLKAY as CIO, and obviously, I'm sure a lot of the Chime organization and other communities that we take part in. So thanks so much, Marc, for taking time to share this, and thanks everyone for watching. If you want to check out this video and more great content like it, be sure to check it out at healthcareittoday.com. Thanks, Marc.
Thank you, John, very much.